The coronavirus pandemic is causing major concerns for New South Wales' regional communities as the state enters lockdown at 5 p.m. Dubbo has recorded 26 additional COVID-19 cases to 9 a.m. today, bringing the total number of confirmed cases in the region to 39. Joining me live now is Stephen Lawrence, the Mayor of Dubbo. Stephen, appreciate your time this afternoon. There has been a significant jump in positive results for your region over the past few days. First of all, how are you and the community doing at the moment?
Yeah, look, it seems like a lot more than 3 days ago that this whole thing started, but we're up to a total of 39 cases now in the Western Area Health District. But the community is pulling together. We're seeing overwhelming compliance with the public health orders and just really calling upon the community to spread that message, particularly in the Aboriginal community in West Dubbo, where the large majority of these cases are, those important messages to stay home if any symptoms or concern and go and get tested.
A statewide lockdown has been called for this afternoon. Are you in favour of that? Do you wish it happened earlier?
Yeah, look, we've been living the lockdown now for 3 days. I think the news of a statewide lockdown will come as a relief to many people in the Dubbo region, but will certainly really hit small businesses and so forth and big businesses. So, yeah, look, just really difficult times. But the mood in the community, as I assess it, is people just want to do what has to be done to contain and eliminate this virus from our region.
The Indigenous community has become a real concern. How are you focused on testing and vaccinations at the moment?
Yeah, look, what we're seeing is incredibly concerning. It is the first outbreak of coronavirus in an Aboriginal community in Dubbo. The very large majority of the cases are in young Aboriginal people in West Dubbo. We are working with the state government. We put up a testing facility in West Dubbo. There are lots of appointments now to get AstraZeneca and Pfizer down the track. So ramping up testing and vaccines in the Dubbo region, because we're talking here about highly vulnerable communities that are really interconnected to big Aboriginal communities to the north and the west that are even more vulnerable in some ways. So important to contain and eliminate this virus from our region.
And Stephen, how is the vaccine rollout tracking at the moment for Dubbo?
Yeah, look, a lot has changed in the last week or two. A lot more people are getting the jab and making appointments. But as of the 1st of August, I think it was, the Arana and Far West was the lowest in the state in terms of the fully vaccinated group. Aboriginal people, again, as I'm advised, are about a third of that amount. So they are tracking far behind. And now that we have seen the first big outbreak of coronavirus in an Aboriginal community, really calling upon our Aboriginal citizens here in Dubbo to make appointments to get vaccinated, to stay at home if any symptoms or concern, and go out and get tested, because it's spreading like wildfire in West Dubbo. Very small, discrete part of Dubbo. It's moving around the community there.
It's hugely concerning. There were reports of long testing lines this week. As you mentioned, it's been 3 days now of a lockdown. How is the capacity to test this weekend, and what have you heard from today?
So I just got a test in West Dubbo, and I lined up for about half an hour at the testing facility in West Dubbo that's run by State Health. There's longer queues at the showground, which is a drive-in facility. But no, people shouldn't be concerned about going. It's quite accessible. It's quite doable. We need to test a really significant part of the community here to get a handle on community transmission. I'm told by the CEO of Western Health that 11 of these cases are not linked to a known cluster. So very, very concerning. We need to get on top of community transmission so that all the contact tracing can be done.
There's around 20 locations which are now a concern in your area. Do we know exactly how the virus arrived in Dubbo?
Look, we know that that a person travelled from Bathurst to Walgett through Dubbo. We know that that has been a source of transmission, but these things are still being looked into. But what it shows, it's come here extremely quickly. It's spread extremely quickly. The Delta variant is 3 times more infectious than the usual strain. So we just need the community to pull together. And most importantly, we need everyone to get the public health messages out to family and friends who don't necessarily hear the mainstream messages. So that's really important for the community to be advocates on behalf of the community.
Yesterday, there was a man charged with faking a COVID-19 test result in a group chat, which ultimately then closed his workplace. Do you have an update on that situation at all?
No, look, I know that matters before the courts. I'm not sort of familiar with the circumstances of it, but obviously really strange and deplorable behaviour if that's occurred.
And Stephen, just finally, what is your message to your community at this time?
Stay home, stay home, stay home.
It's a good message. I think we need it right across the state right now. Stephen Lawrence, I appreciate you spending time with us this afternoon. Thank you.
Always a pleasure. Thank you.